Here we see a typical example of a primum defect. We can nicely appreciate that there is malformation of the AV valves. AV valves are here on the same level. Normally we would expect that the tricuspid valve inserts somewhat more to the apex than the mitral valve, and in this case we see this is just one valve level. We have this large defect here, and we have a lot of left to right shunt and significantly enlarged volume overloaded right ventricle. On the left hand side, again patient with primum defect, and we see that these defects are in general associated with AV valve regurgitation caused by the malformation of the AV valves, and we nicely see mitral regurgitation. We see a jet here coming from the crux, going from the left ventricle to the left atrium, and we also see some tricuspid regurgitation. Again, here an example of primum defect. The defect can nicely be appreciated here. Again, we see the malformation of the AV valves, and in this case we see that there is a continuum towards from a partial AVSD to a total AVSD, and we see that there is actually also a defect on the ventricular level, but this defect is more or less covered by an aneurysm coming here from the AV valves. So hemodynamically we have only left to right shunt on the atrial level, and there is no shunt on the ventricular level, so hemodynamically it's more or less a primum defect in this patient. These short axis views nicely show the cleft mitral valve. We see that there are two separate parts of the interior mitral leaflet, and we see here the cleft, and on the right hand side we see the regurgitation caused by this cleft. This extent of regurgitation can vary from even no regurgitation to severe regurgitation, and of course this changes the course of the disease and will also cause then left ventricular volume overload with all its consequences. Here a typical example of a secundum defect. It's not 100% clear from the 2D image that there is indeed a defect. This could also be a dropout here in this view, but with color Doppler we can nicely confirm that there is a rather small defect, and this is consistent with the right ventricle, which is not really significantly enlarged, because this small shunt doesn't really cause significant right ventricular volume overload. Here an example of a sinus venosus defect, again a transesophageal echo, and this already shows that this kind of defect is in general in the adult population very difficult to image by transthoracic echo. Now this long axis view by DEE shows again the SVC coming down here. This is the right atrium. We show the interatrial septum and the left atrium, and can nicely see the shunt from the left atrium via this defect into the right atrium.